Okay, so I'm here with my senior general nurse, Madam Rebecca Kumah. Good afternoon, Madam.
Good afternoon.
Please, are you a frontline health worker?
Per the definition, I would say I am. So, just like it was said that every person working in the COVID center or rendering direct care to COVID patients were considered as frontliners. So, I would say I am one.
How has your experiences been being a frontline worker?
For me, as a frontline health worker, at that time, things were really tough. At a point, we needed to stay back at work to manage our clients so that we are not able to go home to even see your family members. You need to keep social distancing as far as possible from your own children. Some of us needed to stay back in the hospital, sleep over, do a 1 week shift in, and then go home for 1 week. Then we're alternating that way. They did that for us also to be able to recoup from the stress accumulated over the week, so that you are given a week rest and then you come back. So we're running that kind of shift system with teams.
Does your facility have adequate medical supplies to manage the number of COVID-19 cases that come in?
Well, for that I can say yes. For the facility being assigned or designated as a COVID center, we had supports coming in from private sectors, corporate bodies, and the government also committed resources into that. So we were given enough PPEs, whatever we needed to work with, we were provided with, from our head covers, our foot covers, our gloves, our coveralls, nose masks, N95, everything, face shield that we needed. The argument is that if you are not properly dressed and you go in there and infect yourself, you are infecting every team member. So the health workers needed to be properly dressed. So for Ga East Municipal Hospital being the National COVID Center, we were properly provided with equipment to actually work with. So we didn't have a time where there is a shortage of PPEs that we couldn't nurse our clients. It was adequate. I can say that.
Can you share some insight about how healthcare professionals handled the COVID-19 pandemic? Would you say that your colleagues were overwhelmed with the number of cases?
At a point we were. I quite remember sometimes you need to work extra shifts. We were to do 12 hours, which got most of our team members some time breaking down. Even though we were given prophylaxis as well, we were ensured that we were checking our vitals ourselves. Even at the reports of work, you check your vitals before you take over. When you close, you check as well. We were giving vitamin supplements, but as usual, the protocols were outlined. People will still not adhere, and so at a point we were stretched. We were actually stretched. And the public will even testify. Those who actually came on admission, some of them went out there to say that people should take good care of themselves because their facilities are getting choked. And then at a time where we were actually almost getting overwhelmed was just some time after the Christmas. The activities, people coming in, family gatherings, exchange of items, eating here and there. So when the Christmas was over, we came in January, February of 2021. It was quite hectic. The ICUs were getting full. Sometimes we were told that we were not even supposed to don and stay in with our clients for more than 45 minutes. But at a point, we realized you could be in there for more than 2 hours because the care services to render were a lot. And then the staff, most were breaking down. We got some few colleagues getting infected along the line. But thankfully for Ga East Municipal Hospital, we didn't record any negative or unfortunate eventuality of any staff dying. Let me put it that way.
Okay. In your opinion, what strategies do you think the government should put in place to be better prepared for public health emergencies like this in the future?
The first thing I want to talk about is infrastructure, because it was just fortunate coincidence that this facility was available, and then just around that time that we needed, so they had to shut down opening to public services to just manage the pandemic. what was going to happen if there was nothing like that. Because the new COVID infectious disease center that was set up, built along the line, came in when the fear of the surge was coming in. Then they had to commit private sector, whatever, to come and put it up. So we asked ourselves, what was going to happen if this facility was not available? It will mean that we're going to shut down other facilities, send patients home or what? So I believe infrastructure is very important. Government should look into setting up health infrastructure in almost every region. An infectious center, small, attached to the district health directorates could help, so that we can start managing before we even escalate into bigger facilities.
I believe one of the challenges the government is facing right now is to achieve herd immunity. Do you think Ghana as a country has adequate capacity and mechanism in place to receive and then provide vaccines to all citizens?
I believe so, because Ghana Health Service with the epidemiological department, they are really up to the game. We were able to at a point eradicate polio from Ghana, so I believe we can still do that, because for Ghana as a developing country, we have been going through immunization all this time. All this while we've been doing it. It's nothing new. And then our public health nurses, our community health nurses are always up to the task. They could go length and breadth of the country, across rivers into the hinterlands, just to get children immunized and vaccinated. So doing that it's not an issue at all. We just have to put in a little bit of a storage system, so that the cold chain system, how we manage it properly, so that when the vaccines are being kept, they are not spoiled, or let me put it that way.
Okay, as a frontline health worker, do you have any advice for the general public, especially people who think that COVID-19 is not real?
Sometimes I wonder, if I doubt why people still think that the disease condition is not real. I have been working in this facility for a year now. I think 2-3 weeks ago we celebrated our 1 year anniversary as the facility starts managing COVID. I have seen cases. I have seen real symptoms of the COVID. We've seen people lose their lives, unfortunately. It hasn't been easy. I have personally lost church members, which was not easy at all. And for us as developing country, where we have communicable and non-communicable diseases already with us, especially diabetes and hypertension, those ones are even cause the disease progression and prognosis to be poor. And most of our citizenry, I can tell you, are living with diabetes and hypertension. So coupled with COVID, it's a whole big deal. We plead with the public that they should help us, so that we all help ourselves. We also have family members, so that together as a country we'll be able to sail through.
Okay, Miss Rebecca Kumah, you and your fellow health frontliners have taken a very bold steps. You people have laid down your life. It's like you are looking at death and then you are going for it just to save other people's life. Ghana is very proud of you, and then we thank you very much for your time.
Thank you very much for having me. I hope and do pray that this message goes the length and breadth of whatever it has to go to, so that our people out there will also support us as we have pleaded with them. And as I said, together we'll be fine. We'll get there. Thank you.
Thank you.